A board certified pediatric dentist is someone who didn't just do general dentistry, didn't just do their specialty training. They went above and beyond what a normal pediatric dentist does to achieve the highest designation in our field. It's a rigorous test, oral 2 hours straight, also a written exam, and not everybody passes. So, someone who's a board certified pediatric dentist is basically the most qualified and most experienced person to make decisions that are up to date for your child. One thing I use for almost every child is something called Caries Risk Assessment. It's basically a tool that we use to individualize care for each child. We see some children that don't have cavities for 1 or 2 years straight. We have other kids that have cavities every 6 months, unfortunately. And based off of not just their cavity rate, but the anatomy, the shape of their teeth, medical factors, other socioeconomic factors, we can kind of tailor our treatment needs and our plan for each child individually. Some kids, again, need more preventative care, and other kids, we can kind of back off and, take it a little more slowly with them. Each child is different. So, Caries Risk Assessment is a tool that I use pretty much every day on every single child. What we do at the first appointment for children is we assess each child, in their own way. It starts from as soon as the kid walks through the door. Our front office staff, lets the kid get comfortable, lets them accommodate to the office. And we usually will give the child a little tour around the office. At that point, our assistants even are trained to kind of gauge child behavior. Every personality is different, right? We have outgoing children, nervous children, shy children. We have some children that can barely even walk through the door. So when we see those types of behaviors, we can kind of look and see what treatment and what modality is best to manage the child and help the child through the appointment. A board certified pediatric dentist, again, is someone who has achieved the highest designation in our field, right? A lot of people graduate through pediatric dentist school, but very few of us actually achieve board certification status. So someone who's board certified is basically the most up to date. To maintain our certification, we have to take about 25 to 50 hours of continuing education in our field every year. We also have to pass examinations to maintain our board certification status. So someone who's board certified is pretty much up to date in the most current modalities of treatment for pediatric dentistry. Anyone who would be doing sedation or doing treatment on your child, those are the most qualified and most, educated in these topics to handle these kind of scenarios. To maintain our board certified status, we have to do a lot more training than just, regular CE. We do have to do 25 to 50 hours of continuing education every year or two to maintain our status. We also have to take annual examinations that will help, keep us up to date. So, board certified pediatric specialist is someone who is the most qualified to treat your child and the most up to date to treat your child. One thing a parent should feel when they leave our office is that they should have absolute confidence that they provided the best care for our child. You're here in Sorrento Valley Pediatric Dentistry with board certified specialists, extremely qualified assistants, and front office staff who know how to manage every aspect of your child's appointment. We're here to take the best care of your family.